Hello, good afternoon, everybody. So this session this afternoon will delve into the principles of patient-centered safeguarding for creating an environment that prioritizes the protection and well-being of our patients. So I'm going to direct my first question across to you, Dr. Maryam, if I can. So how can healthcare providers balance safeguarding patient safety and respecting their autonomy, particularly in vulnerable populations?
Hello, Paula. Thank you all for having me here today. I'm guessing it's a very critical topic, especially for patients who come to the emergency department or any critical care area. And coming from an emergency department, I would say it is very difficult to navigate between healthcare providers and then the length of communication that they have with patients, especially in a high acuity setting like the emergency department. So I would say that they have to, first of all, address who are the vulnerable patients. So vulnerable patients like elderly patients, patients who are special needs, children, or patients who need someone to check for their capacity to give decisions, especially if that decision is going to affect their life regarding their medical care. So starting with addressing who is in the room and checking who is going to take care of that patient specifically upon discharge from the department. Say a decision of an elderly who comes in requesting to be discharged after a pneumonia, for example, those patients will have someone to take care of them at home. So the decision has to be shared between physicians and patients. The second way of tackling this is basically by addressing their fears and having a way that they can communicate through. So whether if it was by a platform, and this is something we have, especially at Cleveland Clinic, there's a platform that is available for everyone where they can communicate with their patient, with their disease and the type of illness and symptom that they have to watch for. And this is a platform that is available for every patient that comes in to the UAE, and then they read basically what are the risk factors and the disease expectancy and the length of the disease. Another thing I would say, and especially when it comes to decision making regarding the patient who comes in with psychiatry illness. Now those patients, if they have any medical problem, they wouldn't have the decision or the capacity to address their disease. Any patients who would require a cath lab, for example, activation, but then they don't understand the concept behind it just because of their psychiatry illness, that's also a way to address it through their caretaker. Now, being in a culture where it is very diverse, and you'll see a lot of patients walking to the emergency department with their uncles and aunts and granddaughters and all of that, you need to address one person, and that person should solely understand everything going on with the patient, and making sure when that patient gets discharged from the AD or gets admitted, they understand fully what's happening.
Okay, thank you. So Mary, to expand on that a little bit, it's been a very long journey for M42 to implement the safeguarding strategy. So can you tell us a little bit more about that, please?
Of course. So M42 is leading the way nationally within the UAE. We've a very strong team, and I'd just like to take a moment to thank the leadership for that, for putting a dedicated safeguarding team in place. Our team is made up of diverse professionals from social workers, psychology, and clinical nurse specialists. And we are so reflected in our work and so committed to our work that we have a 24 on-call service so we can support staff and patients all the time. While we do that, we also adhere to national and international policies, and that's why we have made some changes in regarding robust policies and strategies within 442 regarding child protection and the vulnerable adults. We also are committed to training our staff, whether it be patient-facing or non-patient-facing, so they know the signs and symptoms of neglect and abuse and the referral pathway. So all of these things combined, I think, have made us very strong in the UAE. People are looking towards us as a team that's dedicated and that is pioneering in the safeguarding field.
Thank you. And we know healthcare expands beyond the walls of the hospital. So Shaikha, for you, please. Tell us about the community service initiatives done as part of the safeguarding program at M42.
The M42 safeguarding team The M42 safeguarding team enhancing health awareness and also improving the healthcare access and promoting overall wellness. With some keys, we have health awareness camping, educating communities in chronic disease, mental health and provided care. And also we have collaboration with the government organization, being a partner of schools, university, and also other government organization, enhancing the health service and education. Also, we have supporting vulnerable population, offering for them service and family counseling, and including individuals and elderly, also to have like more than service. And also we have mental health, raising awareness about mental health issues, providing for them resource and supportive service, including Esclerosis Mental Helpline. That's all.
Thank you. Khalude, as the first Emirati safeguarding specialist in the UAE, tell us what it means to you to be pioneering safeguarding.
Right. First, I'm grateful to be here. Thank you, everyone, for having me here. To be pioneering it, it's powerful, right? It's the first time we've had a safeguarding specialist in the UAE and in Emirati. I'm rather grateful for it. I want to empower others to be safeguarding as well. I want to reach out to the community and make a difference, and hopefully have the wider community and do safeguarding and be a part of it and have awareness everywhere, and for us to make a difference, to really see the UAE grow even further. Growing up in the UAE, it has vastly changed. So from the way it was when I was younger and now, so it really means a lot to me to be in this position to make a difference and to empower others to also make a difference. Thank you.
Thank you. So raising awareness and empowering people within our network is really important. But for those caregivers who are within the hospital for you, how do we ensure that all of our staff are trained adequately to be able to deliver what is required from this initiative, Dr. Maryam?
That is actually a very important question. And given the fact that we do have, we face a lot of burnout between physicians and patients ratio, so physician to patient ratio all around the world, I think it's very well known that exceeding expectations of the time that they get seen by a physician, the time they get a follow-up in a clinics or something. So having said that, our physicians have their special connections with patients, and that's something I've noticed, and it's very honorable to see that physicians actually share their own phone numbers and their own email details, their personal details sometimes, just to make sure that those patients gonna find a way to communicate. And working in a residency program, just like any other hospital that has a residency program, we do have a physician who comes in and give our residents talks and everything, and you would notice how humble those physicians are. They would request the resident to call them anytime they want regarding a patient, and that's something that is very special and touching when you see the human touch between physicians and patients. Another way of communication would be through a platform. We have, say for example, I work at SKMC, so we have a Saha platform. Saha platform has a way that you can communicate with the physician, and you tell them if there is any issue, and that physician will follow up with them and see where do you need to go. I do emphasize the good use of a primary healthcare. Now, this is something that patients has learned to know that not every disease require you to go to the emergency department. So if you're going to a healthcare, you would be addressing all your problems. You'll have a longer time with your physicians. Your treatments of a disease that a physician in the emergency wouldn't understand would be more addressed towards them. Your lifestyle modification can easily be fixed as well. So and you wouldn't even fall into the burnout phase of a physician's. Why? Because we treat simple flu in the emergency department, but at the same time, we treat something who's highly critical, just like an MI and everything. So the triage level will change. So you would be seeing a GP, for example, if you have a flu. But if you were in a family medicine, you would still see a specialist, you would still see a consultant, they would address you better. So the level of acuity is very important as well when it comes to patient safety. Another thing would be, now we're in the generation of AI, you would notice that patients comes in and they know the disease that they're talking about. They're worried about specific things. Addressing these questions would be very well addressed in any department that they meet up physicians. But again, they need to understand what pathway they're taking instead of taking it over to the wrong pathway. So I guess, yeah.
Yeah, so actually filtering our patients through primary care to ensure they're accessing the right level of care the first time around is the best for all. Are we doing enough to safeguard our physicians from feeling the burnout in the first place, though? Are we safeguarding our doctors?
I think that's a question that, I've been working in the emergency department for 12 years. I definitely have passed through burnout. We do address it, I think, department by department rather than on a hospital. We are trying through ESAM and EMA to create a way, and we are surveying physicians in the department to check the level of their burnout, and that's by the rhythm of their shift changes. So like going from morning to afternoon to night is very mandatory instead of flipping out your schedule. And if they did the flip by their own self, then they need to understand the consequences behind it. Now we address the needs of taking annual leaves, taking breaks during shift, whether it was 20 minutes break or an hour, just to make sure that they detach between patients. And especially if we're working in a high acuity unit, like we have a critical care area in the department. So after running a code, you would see a behavior that the social worker will come and will get coffee and donuts for everyone in the department, make sure that the physician is not seeing the next patient, he'll take a break before seeing the next one, just to address the feelings and the emotional stress that he's been in, and then sort of like detach from this setting of the ER and then go back into it. I do believe that we address burnout more in residency, unlike when we grow into the system in the department, and that's something crucial that we're trying to work in with Emma.
Thank you. Khalude, what strategies have you employed to educate others about safeguarding in the UAE, and how have you addressed the challenges of raising awareness in such a culturally diverse environment?
Well, firstly, when it comes to protecting our vulnerable population, the most important thing is to have education. So we can't protect them without the right education. And not just education for our clinicians, but education for everyone. Absolutely everyone should be aware of what are our concerns, what are red flags, what forms of abuse, and etc. So getting the education across everyone, the basic education, making it accessible to all staff, no matter what their background is, no matter what their educational background is, cultural background, having their diversity, or like even what language they speak, we get it across everyone, ensuring that everyone is well informed. And then from that, we would like to educate the wider community. So we would do that by campaigns, by awareness events. We've already done a few last year. We've done domestic abuse discussion events. We've done events for men's health and for safe summer, back to school, safety for children. We want to spread awareness in all areas of the community. And this year we're hoping to do more. We're hoping to get across to schools, even go out to the community, to go out to other hospitals, to do something for the wider population. And we're really happy to be able to be in this privileged position to spread the awareness to everyone and educate all other people.
Thank you. And Shaikha, as a clinical social worker, do you find your work with safeguarding impactful?
Yes, as a social worker focusing on safeguarding, we have high impact for several reasons. for example, as a social worker, we have good important role to protect vulnerable population, including children and people with disability from the neglect and abuse. Also, we have empowerment. So as a social worker, when we have any patient or a client, we empower them, we show them their rights and let them understand the law and the UAE. And so they can know their needs, and they can advocate for themselves. Also, we have community engagement. We engagement about raising awareness about safeguarding issues, show them our support and service we have it.
Can you share some key highlights that would enforce your position here?
Community engagement, empowerment, protection vulnerable population, that's all.
Okay. And Mary, how do you envisage the future of safeguarding across M42?
Well, to pick up on something Dr. Maryam said, M42 is leading the way in global technology. So I hope that the team will take full advantage of that and take advantage of AI and data analytics to summarize our patients and to collect data on them and to use issues in safeguarding to be able to highlight it. We also want to get more involved, as Khalude said, in the schools, in universities and other healthcare facilities who are looking towards us as we are on the ground working with the patients. So we'd like to offer what we have done to get to this point to other facilities. So we're hoping to roll out this year. But most of all, for our staff and patients, I'd like to think that we could be in an environment, and the safeguarding team is offering them support where they have the ability and feel empowered to speak out. If they see something wrong, if there is a red flag, that they're not afraid to pick up the phone to us or talk to one of our safeguarding links, and we will be always there to support them. Indeed, on a national level, I'd like to think that the UE is moving forward. Every day that I'm here, there's always new policies and there's new laws. And I think that if we could be a voice at that table regarding strategy, I'd like to think the safeguarding team could do that. But in general, I think that we're doing a really good job, and I think we have more to give next year.
And if I can extend that question across to you, how do you see the future of safeguarding within the UAE in general, Dr. Maryam?
Well, according to data and research, I would say that we are addressing every subject separately. So it's either with the physicians and with the patients, trying to create a community as well. Just like Khalude has mentioned, we do have communities when it comes to diseases in specific. We have diabetes community where they communicate with each other when it comes to a new sensor that is landing in the country, or when it comes to a new medicine that they've tried and there's promising results of it. We do have the same thing with oncology and everything. And I think the role of EMA is very addressed nowadays as we see it happening. We do notice there is a communication between different societies in the country, whether it was oncology, ophthalmology, and emergency as well. And reaching out to further towards the community is one of the most important things to avoid diseases as well. So addressing the needs of a comprehensive healthcare test that happens every 6 months for a patient who's above 60, and every year for patients above 40. And there's a specific test that happens for women, there's a specific test that happens for men. And I think this is, by itself, is gonna create a healthier community. Probably you wouldn't notice it at this generation, but definitely the generation coming.
And if you could share one key message with the audience, just to raise awareness a little bit more, just for one key takeaway, what would that be from you?
I think that would be that going into the hospital saying that you do not have any medical illness or problems and your last test was a year ago does not mean that you do not have a medical illness. So you need to address the fact that it's not only on the physician to diagnose you. You probably should work a little bit harder change your lifestyle, modify your food intakes, and then try to visit your primary healthcare before seeking further needs in the emergency department. If you know that you have a problem, it's better to avoid critical events rather than showing up with the critical events because you don't know that you have a disease.
Mary, I'm going to ask you the same thing.
Yes, I think the biggest thing for me is collaboration, and even having Dr. Maryam here today as well just shows collaboration between the public and private sectors, collaboration with the local authorities such as the FCA, ECA. All these things will make a huge difference if we work together for the greater community.
Shaikha, you have one last message. What would you like to get out there to the audience who are listening today?
Don't be afraid. There is law to protect. Anyone have any case, you can just come and share to us. We are here to support you, to protect you as a social worker. Please contact us.
Khalude?
You are not alone. You don't have to live in fear or harm. Everyone deserves to be happy and live in a secure environment. So please speak to someone. Don't be afraid to speak about your mental health or if anything's happening within your family. You're always going to be supported. Thank you.
So I'd just like to say thank you to the panel for joining me on stage today. Very insightful, very engaging conversation. Thank you.